We are a community and mental health trust, and we have around 120 bases, and we have a lot of our clinicians who work out in the community. And prior to the situation we are now with mobile technology, most clinicians had to come into base in the morning to be able to understand what their patient list was for that day and then come back later on in the day to update their records. So we knew from a patient perspective that that wasn't really ideal, and we also knew that we were spending a lot of time shuttling around and spending time in base that could be better spent with patients. We've got around 1,000 clinicians that we've issued iPads to, and we've got probably another couple of hundred that we'll still be in the process of issuing out to over the next couple of months.
Some of our consultant psychiatrists that have been piloting MIA for us have fed back to us that when they're meeting with their patients, they do not like to sit in front of a computer and sit there and stare at the screen and disrupt the conversation. They would rather be sitting there using MIA on their iPad. They can sit in a relaxed pose, continue the conversation and stop the barrier from the PC.
Well, the app actually has allowed me to see a lot more patients, and it has freed up time to use for other commitments. It has helped a lot.
We can use our secure network to be able to access the live version, book patient appointments, which we think is going to be really key to help improving the patient journey, because how great to be able to say to your patient there and then, yep, I'm free, this is when we're going to see you again next time, rather than when I get back to the office, I'll check my diary and give you a call. It's all of those little things that actually improve the patient experience hugely, and also just using the capability of the devices. I very much see it as a clinical tool. I think there's so much that we can do to help signpost our patients to extra support that's available outside of what we offer, whether that be a child who's newly diagnosed with asthma, being able to show them a video of inhaler technique or something like that.
I don't have to spend so much time for a start filtering through the information to make sure I've got the right up-to-date information. For example, if I haven't seen a patient in 2 months or 3 months, I don't need to spend as long looking back to see what information I had the last time I'd seen them. So I can just make sure I've got my appointments booked in and then go and visit my patients.
Partnership working that we've had with ISOSEC and Precise Biometrics has been really useful. We are the first trust to use the mobile solution on iPads at scale here in the UK. So the Store and Forward, the offline app that we've been using, we were the first of type. So as a result of that, we've had a few niggles along the way, and the support that we've had from the companies has been really, really useful. It has felt like we've worked in partnership rather than us trying to find things out on our own, and that's been really helpful for us.